Hi everyone, this is Glenda Ganzon and welcome back to my channel. For today's video, I'm going to discuss the second part of health education, hygiene and sanitation, particularly on the components of health. So stay tuned. From my previous video, I've discussed about the meaning of health education, also the definition of health from the World Health Organization and also from the Oxford Dictionary. And lastly, I've discussed about the narrow perspective of health and the broad perspective of health. So in this video, I'm going to discuss the 6 dimensions of health. The first dimension is physical, but it contains the body size and functioning, also recognizing the need for physical activity, also the healthy foods that we should eat, and the adequate sleep that we should have every day, for at least 8 hours of sleep every day, and we should avoid unhealthy habits. The second dimension of health is social. It is the developing a sense of connection, belonging, and sustained support system, and having a positive relationship with one another. The third dimension is intellectual. So for intellectual, we have to recognize creative abilities and finding ways to expand knowledge and skills by being open-minded. And the fourth dimension of health is emotional. So in here, it is coping effectively with life and expressing emotions in an appropriate manner. And the fifth one is a spiritual dimension of health. For this dimension of health, it includes having a sense of purpose and meaning in life. We should also establish peace, harmony, and balance in our lives. And the last one is the environmental dimension of health. So from this environmental dimension of health, we need to occupy pleasant, healthy, and safe environment that support well-being, positively impacting the quality of our surroundings, including protecting and preserving nature. Learning about the 6 dimensions of health can help a person choose how to make wellness part of everyday life. Wellness strategies are practical ways to start developing healthy habits that can have a positive impact on the physical and mental health. Mental and physical health are probably the 2 most frequently discussed types of health. Spiritual, emotional, and financial health also contribute to overall health. Medical experts have linked this to lower stress levels and improved mental and physical well-being. People with better health or financial health, for example, may worry less about finances and have the means to buy fresh food more regularly than those who are financially unstable. Those with good spiritual health may feel a sense of calm and purpose that feels good in mental health also. Health inequities affect all of us differently. A person who has a good physical health is likely to have bodily functions and processes working in their peak. This is not only due to an absence of disease. Also, regular exercise, balanced nutrition, and adequate rest all contribute to good health. People receive medical treatment to maintain the balance when necessary. Physical well-being involves pursuing a healthful lifestyle to decrease the risk of disease. Maintaining physical fitness, for example, can protect and develop the endurance of a person's breathing and heart function, also muscular strength, flexibility, and the body composition. Looking after physical health and well-being also involves reducing the risk of an injury or health issue such as minimizing hazards in workplace, also in the educational institution or everywhere. Using contraception when having sex, that's one way also. Also practicing effective hygiene, avoiding the use of tobacco, alcohol, and of course the illegal drugs. Taking the recommended vaccines, especially this time of pandemic, we need to be vaccinated, and please don't choose the vaccine that you want, but choose or have the vaccine that is readily available. As they say, the best vaccine nowadays is the vaccine available. We have to get or to be protected with coronavirus, especially the Delta variants, Delta variant, which is very deadly. Good physical health can work in tandem with mental health to improve a person's overall quality of life. I know this time of pandemic, there are a lot of people who are suffering with mental health because of, most of the people are only in the house doing nothing. They've been not seeing their relatives, their friends for a long time. So most of us, most of you are suffering. Most of us are suffering from mental health, depression to be exact. So, for example, mental illness such as depression may increase the risk of drug use disorders, alcoholism, and the worst is suicide. This can go on to adversely affect our physical health. Mental health refers to a person's emotional, social, and psychological well-being. Mental health is also as important as physical health as a part of a full active lifestyle. It is harder to define mental health than physical health because many psychological diagnoses depend on an individual's perception of their experience. With improvements in testing, however, doctors are now able to identify signs of physical signs of some types of mental illness in CT scans and genetic tests. Good mental health is not only categorized by the absence of depression, anxiety, or another disorder, but it also depends on the person's ability to enjoy life, bounce back after difficult experiences and adopt adversities, balance different elements of life such as family and finances, feel safe and secure, and also achieve their full potential. So physical and mental health have a strong connection. For example, if a chronic illness affects a person's ability to complete their regular tasks, it may lead to depression and stress, right? I know all of you already experienced that situation. And these feelings could be due to financial problems or morbidity issue, especially this time of pandemic wherein we have a lot of relatives and friends who passed away this pandemic. A mental illness such as depression or anorexia can affect body weight and overall function. It is important to approach health as a whole rather than as a series of separate factors, and all types of health are linked, and people should aim for overall well-being and balance as keys of good health. So this ends my discussion about the part 2 of health education, hygiene and sanitation, particularly on the 6 dimensions of health and the 2 types of health, which is the mental and physical health. So if you have any question, please write it in the comment box down below. And if you haven't subscribed yet to my channel, please do consider subscribing. and also hit the notification bell so that you'll be updated with my new videos. And if you like this video, please give it a thumbs up and share. Until my next video, please watch the part 3 of this health education, hygiene, and sanitation. Bye everyone. Thank you for watching.